keeping an eye on imaging. Discussion and commentary based on articles from JACC Cardiovascular Imaging.
Hello, I'm Dr. Greg Hunley, and on behalf of JACC Imaging, I want to welcome you today. Today we have Dr. Hugo Katos from Heidelberg, Germany, who's going to speak to us about a new application in cardiovascular magnetic resonance imaging, in which he uses a new form of dobutamine stress testing to diagnose inducible ischemia. Dr. Katos, welcome, and could you tell us a little bit about your new, recently published study?
Well, first I would like to thank for the opportunity to present our data and also for the publication in JACC Cardiovascular Imaging. Very briefly to the background. So the work actually is being done by my co-worker Dr. Korosoglu and Neil Osman. Both have great interest in improving methodologies for detection of regional wall motion abnormalities. And Neil Osman has, from Johns Hopkins, has developed a software where he can color code the strain of the myocardium. And by this color coding improves visualization and also quantification of wall motion abnormalities. And with this technology, with the SENC technology, they could show that in patients with coronary artery disease, you have a higher precision in predicting myocardial ischemia by this technique. Now, with the present work, we went forward and tested then when we use less intensive dobutamine stress test, can we then have the same precision as with full dose dobutamine stress testing and having less risk associated with that procedure, first. And second, if we go to full dose dobutamine and use the SENC technology, do we identify more patients with coronary artery disease? So the study then included 80 patients which underwent cardiovascular MRI imaging, and all patients afterwards, within eight days, underwent coronary angiography. And the coronary angiograms were quantified as a standard methodology. And it turned out that those patients having significant coronary artery disease were 46 patients. And from these 46 patients, 45 were correctly identified by full dose dobutamine stress testing using the SENC technology. However, it was only 39 when one uses conventional wall motion analysis. And importantly, when one goes to the 20 microgram per kilogram dobutamine dose, it turned out that one has the same sensitivity as with full dose dobutamine stress testing when using conventional wall motion abnormalities. So the data indicate by the SENC technology, one does have more precision and more sensitivity for the detection of coronary artery disease, and that may translate to more patient safety and more precision in diagnostic testing.
So it sounds like you had two new important features. The first being a more rapid test. You could identify abnormalities at a lower dose of dobutamine. Right. And the second is a quantitative measure that would facilitate physicians in interpreting the tests, where before they might not be able to recognize the wall motion abnormalities. What patient populations do you think this will be useful for? And then what do you see are limitations to advancing this technology out into clinical practice?
Well, the study population was a selected group of patients with an intermediate risk features. There were no patients with previous myocardial infarction, since we selected for patients without wall motion abnormalities. So the group of patients will be those with intermediate risk features to be identified by that technology. The second point is what is the translation then to clinical practice, and what are the limitations? So right now it still is a technology which is not included in the process of MRI imaging, so it's a post-processing procedure. So with a faster SENC technology, we hope then to really have online data and identify online those which have already a wall motion abnormality. And the most sensitive measure was actually not strain, but strain rate, which turned out to be more sensitive than strain. So with strain weight, we could hopefully have then included in the online analysis a more faster and more precise testing.
Dr. Katas, I want to thank you very much for sharing your time with us and for this very informative study.
Okay.
It sounds like you'll be working with both small and larger industry to help move this into clinical practice, and this new innovation could be very helpful for managing patients with cardiovascular disease as we look for new technologies to identify those at risk of cardiovascular events. Thank you very much.
You're welcome.